Hello, everyone. Welcome to webinar Enhancing Patient Engagement with AWS. My name is Anu, and I will be your host today. In today's webinar, we'll be covering quite a few topics. We'll be covering about Apexon, who we are and what we do. Second, we'll be covering our strategy and vision in the digital health and life sciences space. We will talk about the highlight of a webinar, the patient engagement solution that's built on AWS. Some of our success stories and our way forward in the healthcare and life sciences space. Joining us for this webinar, we have three presenters. I'll start off with Rajan Manjani. In his current role, Rajan leads the domain solutions and pre-sales function at Apexon. He is responsible for generating account growth and taking solutions to the market. He brings with him nearly 25 years of diverse experience in consulting, domain, customer management, and account growth across all verticals. Second, we have Dr. Jagadish and Suresh, or also, as we like to call them, Dr. Jags. With a deep understanding of the healthcare ecosystem, Dr. Jags has led multiple digital health initiatives across the globe for Apexon. He is a former clinician who also holds a master's degree in healthcare administration, both of which have informed his understanding of the global digital health landscape. Last but not the least, we have Vikram Singh from Amazon Web Services. Vikram leads the global healthcare partnerships for AWS, and he's responsible for helping the partners innovate and grow faster with GTM Motions, AWS Partner Network, and the AWS Marketplace. Vikram is also responsible for creating AWS Healthcare Partner Strategy, along with recommending and recruiting strategic partners. Vikram has deep healthcare expertise, having spent almost 23 years in the domain, both as a customer at United Health and Cigna Healthcare, as well as on the consulting services side with large ESIs like Tech Mahindra and Wipro. Now I would like to hand over the presentation to Rajan Manjani, who will talk about the company and what we do. Over to you, Rajan.
Thank you, Anu, for the introductions, and thank you all for tuning in for the webinar today. Let me kickstart the discussion with a brief on who we are and what we do. We are a digital-first technology services firm backed by Goldman Sachs and Everstone Capital private equity companies, specializing in accelerating business transformation and delivering human-centric digital experiences. For over 25 years, Apexon has been meeting customers wherever they are in their digital life cycle and helping them outperform their competition through speed and innovation. And we grew quickly by helping enterprises respond to insatiable market demand by combining our expertise in digital engineering, experience engineering, data and analytics services with the latest practices in cloud, agile, and DevOps. Today, that journey continues with over 6,500 professionals and industry experts. Apexon is headquartered in Santa Clara, California, with 20 plus delivery centers across the world in US, Canada, UK, Middle East, and India. Our industry and domain expertise is across 4 key verticals, including banking, financial services, auto manufacturing, high tech, and healthcare life sciences. Apexon has the scale and reputation to work with some of the world's leading brands, yet we are small enough to make the success of every customer projects. As our motto goes, we are big enough to depend on and small enough to care. Another aspect is our NPS score, right? So NPS score is a testament to the fact that with an NPS score of 84, our growth is fueled primarily through referrals from happy customers. Let me talk a little bit about our experience in healthcare value chain. Healthcare and life sciences, as I said, is one of our key verticals, and Apexon has a footprint across the care continuum. We enable the latest in digital medicine for leading healthcare providers, large payers, and health plans. And we extend it even to the device makers and life sciences innovators with our expertise in applying the latest in mobile and IoT technologies. Our capabilities in strategy, development, testing, are delivering important results for the healthcare industry across the entire value chain. Say, for example, we have partnered with some of the largest provider organizations in the country in upgrading their telehealth platform during the pandemic, supported many in their hospital operational optimization visions, and facilitated superior patient experience, leading to more effective care delivery and coordination. Apexon supports one of the top 5 payer chains in enhancing their member experience and enrollment portals. Our data analytics service line helps in mitigating fraud, wastage, and abuse with payment integrity solutions, which we have built over a period of years. Cloud integration and application migration and modernization is another area where we have helped quite a lot of customers of ours, especially in healthcare and life sciences and beyond. For life sciences and pharma clients, we are driving innovation where it has the greatest impact in reducing their cycle time for new innovations, doing clinical trial managements, and supporting leading organizations in consumer medical devices segment. I will move on to the next slide, which talks about the patient experience and how we have helped quite a lot of customers. So patient engagement involves motivating individuals to participate in their own care, which leads to better health outcomes and lower costs. Modern healthcare is complex, and many patients struggle to obtain, process, communicate, and understand even basic health information services. So many patients, as we know, lack health literacy or a true understanding of their medical conditions and are overwhelmed by the sheer scale of medical information. So here our objective is to drive digital health initiatives and to facilitate active patient participation and promote positive health behavior and compliance. Many public and private health organizations are employing strategies to better engage patients, and Apexon partners with these organizations to help realize these goals. Today's patients seek on-demand healthcare, and I'm going to talk a little bit in the next slide about consumerization of care. So when we think of on-demand, we think of consumers who want things at their own convenience, on their own time, and wherever they happen to be. Mobile and real-time access to patient data is especially important in this transformation. So Apexon solutions address these needs with a laser-sharp focus on primarily 4 things: patient convenience, which is all about intelligent triage and smart scheduling, enabling on-demand virtual care, continuous remote monitoring with wearables and home care devices, and eventually improving patient outcomes. While the digitization of healthcare is happening in a faster pace than ever before, streamlining operations and lowering cost, there are still challenges and obstacles which we have to overcome together. And if I have to talk about these, these again, we primarily actually put it in 4 bucket areas. Number 1 is the high cost and inefficiency of patient care. Number 2 is impersonalization of the patient-provider relationship. Number 3 is the inability to connect disparate digital health record systems. And number 4 is integrating and tuning new digital capabilities with the existing IT infrastructure. So overall, our healthcare life sciences vertical crosscuts all these use cases to capture a comprehensive picture of patient experience. Our tools allow care teams to leverage data that would otherwise be archived in silos and address emerging patient care.
Well, thank you so much, Rajan, for setting the context and telling us about Apexon's approach towards supporting patient care and using technology to drive the same. Now, for the next section of the webinar, I would like to introduce Vikram Singh, who's going to talk about the patient experience from the lens of healthcare providers and what role does AWS play in it. Over to you, Vikram.
Anu, thank you, and I appreciate you inviting me for this webinar today. So let's dive straight into it. Today, healthcare consumers expect the same convenient, on-demand, personalized experiences like they have with other areas of life, from retail to travel to financial services. The Amazon retail experience, food delivery, airline purchases, and online banking are all on-demand and personalized. Can you imagine if ordering from Amazon Prime required you to call a contact center, wait on hold, provide all the personal information again, and spend several minutes every time you make a purchase? Well, that's the typical healthcare experience still today. And healthcare consumers like you and me and everybody else, including our global community, expect on-demand, flexible, fast and easy, and price-transparent experiences. These are features of every product and service in their life that inform their expectations for their healthcare experiences. The digital tools made available by AWS to healthcare organizations are originated in the Amazon online retail environment. These tools come with more than a decade of experience in creating superior customer experiences. Now, AWS is bringing this full cycle consumer experience with healthcare with all of our capabilities to manage the entire omni-channel center relationship with healthcare consumers with a digital front door. Now, together with specialized products and offerings from our software vendors and consulting partners like Apexon, AWS provides that strategic digital platform. Now, this digital front door is a seamless experience that welcomes and guides patients from discovery of health services through discharge and follow-up, whether they engage through a website, a call center, a patient portal, or even a physical door. It personalizes the patient experience by letting patients know that we know who they are. So what's possible with the tools? First, convenience. Booking appointments online at the time that's convenient for you, scheduling appointments that work for your schedule without waiting on hold and without repeating the same personal information every time. And then enabling virtual care visits by taking other patient preferences into account. Second, transparency, being given care options and the ability to see and compare prices upfront. Third is quality, delivered through the most modern technology platform, in addition to the best doctors and healthcare outcomes. And again, last is personalization, attention to patient references, and the ability to proactively anticipate patient needs. Here is a live connected health example. In this example, the patient schedules an appointment with an intelligent automated attendant and requests a prescription through an on-demand video with the provider. Let us pause for a few seconds and see the patient journey on this slide. And now let's break down this experience and see what is behind it. The patient journey is intuitive and personalized. The contact center provides personal, automated experience, and there's a holistic view with the patient at the center. Now, patients take control and navigate to the right care at the right time on their own through call routing, and then automated appointment scheduling with prescription fill request. I'll also walk you through an example of how AWS delivered for a health plan and what touches the patient centricity here. One of the many organizations in the coalition is Metro Plus Health Plan. We'll call it Metro Plus Health, which insures over 500,000 adults and children across the New York City. during the COVID-19 crisis, MetroPlus Health identified approximately 85,000 individuals who were at risk of comorbid heart and lung disease or immunocompromised. And that would require additional support services while sheltering in one place. Now, in order to engage and address the needs of this high-risk population, MetroPlus Health needed to quickly develop capabilities to connect the individual with the right resource to ensure their specific needs were met. MetroPlus Health Plan also helps address the health and social needs of thousands at risk. AIR NYC, MetroPlus Health, AWS, and a pro bono team from Bain & Company worked iteratively to design, deploy, and refine the engagement process over a 3-week period, which included SMS campaigns that reached up to 10,000 members a day, connecting them to available resources. After the initial pilot, MetroPlus Healthcare managers began leveraging a CBO referral platform called NowPow and existing MetroPlus Health contracts and relationship with food delivery services, including God's Love Will Deliver. As a result, thousands of at-risk individuals were connected with necessary service while reducing their exposure to COVID-19. Anu, back to you.
Now, for this section of the webinar, I will be talking about the highlight of our story, which is the patient engagement solution. And for this section, I would like to hand over the presentation to Dr. Jagadishan. Over to you, Dr. Jags.
Thank you, Anu, and absolutely, I can do that. Hi, everyone, and thanks for joining us in the webinar. So in the next section, let us go more deeper into the patient engagement solution that Apexon offers. And this, of course, is in collaboration with AWS. And in the following slides, we'll go more into the solution, the feature sets, and the business benefits that comes out of it. So Apexon offers a patient engagement solution that utilizes several different services to help healthcare organizations better interact with their patients. This solution, of course, as I said before, is built in native AWS framework and makes use of AWS services, which are built specifically for the healthcare industry. And these services, as you will know shortly, it's not your run-of-the-mill AWS services. These are specifically for healthcare and life sciences specific solutions and services, and which, of course, have been like tremendously helpful for us as Apexon, as a partner of AWS, to build and deploy the solution. So one of the key services involved is in our solution is Amazon Health Lake. This is a fully managed data lake service that enables healthcare and life sciences organizations to store, process, and analyze a large number of healthcare data. And mostly this data, the major problem, as you all know, in healthcare industry is that data is in multiple different sources. It is siloed in its own space. And that's where, like, AWS Health Lake, it's a data integration platform which picks up data from all of these various data sources and help us to gain insights from their patient data and make more informed patient care decisions. Beyond Amazon Health Lake, another service which we have used in our patient engagement solution is Amazon Comprehend Medical. This service is NLP accelerator, which extracts information from unstructured medical text, such as your electronic health records or provider clinical notes. This allows healthcare organizations to quickly and easily extract large amount of patient information, be it patient diagnosis, problem list, medications, or their treatment plan. So Amazon Comprehend Medical does understand the medical nomenclature and help us to extract that critical information, which many times are lost in unstructured text. And third service which I want to highlight here is that Amazon Transcribe Medical, AWS Transcribe Medical, and which is your automatic speech-to-text recognition engine. One of the major problems which any practitioner in US struggles with is that they feel that electronic health records have, even though in some aspects they have made their life easier. In some other aspects, it has become much more complex. A typical doctor provider in US, he spends like nearly 20 minutes to document the patient conversation into the EHR. There's a lot of typing involved. And that's where your transcribe medical helps us. So it helps when speech-to-text conversion. The service helps to transcribe patient encounters, doctor visits, phone calls, and any kind of interaction with your HCP. And this service has been an integral part of our patient engagement solution. Right now, I just highlighted the significant healthcare-specific services, but as you all know, like our solution architecture also involves all of your other native AWS services, the SageMaker, Athena, Redshift. We critically depend on all of those. Overall, Apexon and AWS patient engagement solution allows healthcare organizations to more effectively engage with their patients by leveraging the power of data, natural language processing, and to gain more insights on patient care. So let me next move on to the actual features of the solution. One of the areas where, when we talk about patient engagement, right, there are three areas which we are building our solution around. One of them is virtual care or telehealth. As healthcare costs continue to rise, strengthening focus on these innovative solutions to both manage cost as well as reduce overall spend, it becomes very important. When it comes to virtual care, it means many things to many people. Everything from secure text, phone calls, video conferencing, remote patient kiosk, ICU monitoring, home dialysis systems, all of it are facets of our virtual care solution. Everything falls under the broader umbrella of telehealth. And many organizations have dramatically expanded their virtual care offerings post-COVID. This has come coupled with an incredible amount of utilizations. And right now, patients are eager and rather expect to have their consultations through virtual care, as long as it is not complicated, as long as a provider doesn't have to interact with the patient face-to-face. Virtual care or telehealth solution is very much preferred. And Apexon has a really comprehensive video conferencing solution built in AWS. This is an enterprise-wide solution. It helps with booking and scheduling appointments, clinical coordination services. It's a single platform right from the place where the patient identifies the symptoms, visits the doctor, schedules appointment, visits the doctors, has medications, orders, and fulfills those medications, and also for remote monitoring. It's an entire spectrum or entire patient journey where we have a greater impact on. So in the next slides, we can go more into the features of the solution. So as you can see here, there are three features which our solution enables. So one of them is around symptom checker. So this is where, like, a patient, the moment they feel that they have certain symptoms of a disease, they can quickly log into our mobile portal. They can fill in the symptoms of the disorder, and our intelligent AI, it actually directs the patients to which healthcare provider or which department they have to consult. And similarly, this is also, it comes with a lot of chatbots, omnichannel capabilities, where the patient can search for physicians based on their specialty, charges, appointments, booking schedule, and all of it. So overall, we have a robust virtual care solution with multiple features, and especially everything backed and powered by our AWS engine. Over to the next feature of the solution, if we can move on to it. The other aspect of our entire coordinated care or virtual care solution is personalized healthcare. So what we understand is that patient engagement improves with personalized care. That's where we enable our providers to provide a more personalized care to our patients. And as we all know, chronic conditions do not come in isolation. Instead of instead of like a patient suffering from a single or one or two conditions, more than 40% of US adults have in excess to 3 chronic conditions such as diabetes, hypertension. Many times it run in groups. So another aspect is that having family members with certain chronic diseases such as diabetes, heart disease, high blood pressure, all of it will significantly increase your probability of developing the same condition in future. That's where a personalized care, understanding the unique circumstances and the background from which the patient comes into the consultation becomes very much important. And in a busy clinical setup, it becomes very difficult for a doctor to have this kind of a background view. That's what our personalized care solution enables. Our AI ML models, algorithms establish this kind of predictive relationships. It is all done based on the patient data, the patient background data, the family information, the social history. And based on this, we were able to predict the patient's outcome for certain conditions and alert the providers even before they visit they see the patients. The predictive models actually identify the prognosis of the disease. For instance, right, the training models to predict if the diabetes patients would develop certain complications. It has become very, very critical and very useful. The primary aspect is that unlike our other similar solutions that you can find in the market, this entire AI engine is inbuilt within the clinical workflow. So the doctor doesn't have to go to another system. They don't have to log into a different system just for this particular piece of information. It is all a part of the clinical workflow. They can see the alerts, notifications, and prediction with various confidence intervals within their clinical workflow, which makes their life much more easier. And also this types of analytic approach can help clinical teams address patient deterioration earlier and will cut down significant cost in emergency department visits and hospitalizations. And it's a self-learning system with new data being ingested and processed continuously. Various channels are triggered, and we especially use Amazon Personalize as one of the service in real time to help segment patients based on the historical interactions and their demographic and clinical conditions. So again, this aspect of patient engagement has been greatly beneficial to AWS and also us as an organization. So here we are talking about the third aspect of patient engagement. Initially, we discussed about virtual care, telehealth, then how can we provide telehealth in a more personalized care, taking the patient background into consideration. And thirdly, the remote patient monitoring, because as we all know, the patient care doesn't stop with the doctor visits. There's a whole lot of things which has to happen once the patient goes to his home and follows up with the specifications. And that's where one of the major benefits of remote patient monitoring is to promote patient engagement. By allowing patients to track their own health information and communicate with the providers, our RPM solution can empower patients to take a more active role in their own care. This leads to improved patient outcomes, and patients are more informed, educated, and involved in their own care. Apexon specializes in providing IT solutions for remote patient monitoring. As you can see in the screen, like we have worked with multiple clients, multiple companies, both independent medical device manufacturers as well as integrated hospitals with their hospital equipment monitoring, device monitoring. So we have worked with a lot of firms and implemented systems that allow patients to be monitored remotely. So one of the key solutions that Apexon offers is integration of medical devices with remote monitoring systems. This allows patients to use devices such as blood pressure monitors, glucose meters, and other medical devices at home and have data automatically transmitted to their healthcare providers for monitoring. This can help improve patient outcomes by allowing healthcare providers to intervene early in case of any issues. Beyond this connected care ecosystem, another solution that Apexon provides is development of mobile applications that allow patients to track their health information and communicate with healthcare providers. As you can see in the next slide, our mobile application can come into play even in services such as dermatology, where the patient can take a snapshot of their own skin condition, send it across to the HCP, and many times this enables the HCP either to diagnose the skin condition or schedule an appointment with the patient and ask them to come meet them in their office. The other aspects are around your readmission risk management, because this is a significant part. The ultimate purpose or business objective of remote patient monitoring is to prevent the patient again being admitted to the emergency or an inpatient ward. So we are able to curtail or reduce the percentage of readmission risk for many of the discharged patients with close follow-ups, personalized follow-ups using our real-time care coordination and remote patient monitoring. And moving on to the next slide, as we can see, like till now, Apexon has pretty much a comprehensive connected care virtual health solution, starting from telehealth, personalized care management, and continuous care or remote patient monitoring. But beyond that, we also are looking at the future that we can co-create. And that's where like our work with other health and wellness organizations, especially with respect to Alexa skills, as you can see here, it helps the customers establish healthy routines. Say, for example, the person, the patient can call out and ask about certain information about their own health conditions and fitness goals and health goals. Say users take Alexa support to find appropriate providers near them for particular specialties or conditions. Send medication refill requests, because the entire process of medication refill is kind of quite complex. And all of this are being made more simple, streamlined workflow. And also, say, for example, scheduling appointments and setting reminders. Apexon is currently working with multiple POCs with large hospital systems in the West Coast, in enabling Alexa skill for their symptom checker. This has greatly helped patients during the COVID, the last couple of years, and currently we are expanding it beyond COVID into other primary care practices and pediatrics and IM solutions.
Well, thank you so much, Dr. Jags and Rajan, for your time. So the first question I have is for you, Dr. Jags. The year 2020 brought telehealth and virtual care into the spotlight. We saw providers rushing to make virtual care platforms available for the patients. Now that the COVID-19 is behind us, in your opinion, how does the virtual care evolve in this post-pandemic world?
Thanks for this question. That's pretty much true. So we saw a great adoption of virtual care during the pandemic, but I believe that virtual care will continue to play a significant role in the healthcare landscape, even as the pandemic subsides. The event of 2020 did accelerate the adoption of telehealth, but this trend is here to stay. And even as we move past the pandemic, we can see that it provides a lot of benefits to the organizations as well as individuals beyond what happened during the pandemic. So one of the key advantage of virtual care is its ability to increase access to healthcare for patients, particularly to those in remote and unserved areas. With virtual care, patients can receive medication consultations, diagnostic tests, and even treatment from the comfort of their homes. Additionally, virtual care also offers many benefits to the healthcare providers. It helps to manage their patient workload. And that is one thing which most primary care providers and specialists struggle with. They see at least 20 to 25 patients a day, and beyond that is a documentation burden. So there is a lot of overtime and after-hour stay in the clinical settings. So virtual care during the pandemic has reduced the doctor workload, and that is it is a great help and great morale boosting for the providers, and that is where it is going to continue to be a part of our healthcare ecosystem. The major problem, the reason why this question comes into play is around your payment for payer reimbursement for telehealth visits, and insurance companies and government programs have been slow to reimburse telehealth services at the same rate as in-person services, which has been a barrier to widespread adoption of virtual care. It is definitely crucial for government and private players to come up and with reimbursement policies that encourage the use of telehealth services, and to ensure that patients are not financially penalized for using virtual care option. In conclusion, virtual care has proved its value during the pandemic, and I believe this is going to continue to evolve over the period of time. And hopefully we'll be seeing new reimbursement models by Medicare and other payers, which will include virtual care as an integral part of your patient care management program.
Well, thank you, Dr. Jax, for answering the question. The second one is for you, Rajan. We want to know how your firm is enabling the latest in digital for the healthcare and life sciences organizations, and how does Apexon differentiate itself from the other IT service providers? Can you talk a little bit more about Apexon and the AWS partnership?
Sure. Thanks for asking the question. To put it simply, we help life sciences organizations improve their operations using technology, right? As we are in technology business. With experience of over 25 years, we offer services like digital strategy consulting, software development, data analytics, and testing to help these organizations digitize and optimize their operations. So what sets us apart from other IT services providers is our laser-sharp focus on healthcare and life sciences vertical. And this allows us to have a deep understanding of the unique needs and challenges of these organizations. One of the key advantages of Apexon is our unique mix of seasoned technical experts and our deep domain understanding. Our team is comprised of experts who have a wealth of experience in the healthcare and life sciences industry and are well versed with the latest technologies and best practices. This, in combination of our technical solutions, our expertise, and domain knowledge, enables us to deliver high quality, innovative areas to actually invest in, expand, and innovate, right, with our solutions, which are tailored to specific needs of each client. We understand that healthcare and life sciences organizations have different needs and challenges than other industries, and that's why we focus especially on them. We are here to help them to be more efficient, productive, and effective by leveraging digital technologies. So whether you are a hospital, you are a biotech firm, an insurance provider, payer, we've got you covered, right? So we are here to help you navigate the ever-changing landscape of digital healthcare and life sciences, and to provide you with the tools and expertise you need to succeed.
Now, I have a question for you, Vikram, and the question is, how can AWS customers work with partners like Apexon to drive innovations, and what support does AWS provide for the same?
Well, this is a great question. Let me begin with some background. Now, we had three big ideas at Amazon that we stuck for over 20 years. And this is the reason why we are successful. One, put the customer first, which is why we are customer obsessed. Second is invent on behalf of our customers, which makes innovation as a part of our DNA. And third is be patient while we continue to invest and disrupt with technology. Now, we work backwards for our customers, and together with our partners, we drive innovation, we solve technical challenges, we deliver value to all our mutual customers. To support this, AWS offers a rich portfolio of partner programs to accelerate and elevate our partner AWS businesses. We invest in startups, PE-backed partners, small businesses, enterprise global leaders, to ensure that our collective customers have the partner technology capabilities they need to support their mission statements. Now, also, our investment in partner portfolio development is never done. We focused on capabilities, capacity our customers need today, and we're always looking ahead and around corners for innovative needs that may not know that we would need tomorrow. Hope that answers your question.
Well, with that, we conclude our webinar today. Again, thank you so much to our speakers for conducting today's webinar, and of course, our audience for patiently listening in and sending their questions. If you have more questions or want to know more about the solution or our AWS expertise, feel free to reach us at the email IDs mentioned on the screen. Again, have a great rest of your day, and thank you so much. Bye-bye.